Hello, this is Joe Yuhan here to talk about novel strategies for treating knee pain. So conventional strategy, you could say, is like anything that goes at the knee, but really, if we want to have a more complete and sustainable treatment approach for the knee, we have to think about what the knee is. And the knee is half of the hip, so to speak, or half of the femur bone, and half of the ankle or the shin bone, because that's where the shin bone goes below, down to the ankle, and then the femur goes up to the hip. And so factors above, factors below play heavily into how this joint moves. And so you can think of this joint simplistically as, okay, what does the knee do? It hinges. But it does a lot more than that, and most of our joints in our body do. To be as incredibly athletic as we can be on the trails and elsewhere in the world, this knee has to do more than be a mechanical hinge. It does what are called accessory motions. And accessory motions are little kind of rolls, and you can kind of see how that top bone has to kind of go forward when it bends. You can also get a sliding movement. So as the knee, say you're doing a knee extension exercise, you can see that the shin bone is sliding upward relative to this bone. So those are examples of accessory movements, but there are also other accessory movements, including rotations and shears, which is a side-to-side movement. That's where a lot of knee pain comes from, is when those accessory movements get a little bit out of hand and they become excessive. And so what are two biggest culprits for accessory movements that cause pain are these rotations and the shears. And that's, again, that side-to-side movement that's a little bit hard for me to demonstrate in this model, but you can see side-to-side in this straight plane. And so again, normal movements, but for various reasons, they can become excessive and cause pain. And so what causes dysfunctions or dysfunctional movements in the system? The biggest issue and the most glaring is going to be falls. And so if you fall and you land, say, on a hip where this femur connects in, the pelvis bone itself or the ball of the femur that goes into the socket of the pelvis, that joint or the surrounding tissues can get really tight. And now all of a sudden it's grabbing this bone. And so if tight muscles grab this, it's going to potentially take that bone and move it off axis, meaning it's not going to sit perfectly in the middle, and it may do a rotation or it may do a shear. And the thing with this knee complex is it doesn't like too much of that. If it gets too much of it, then its physiological movement, the bending and the straightening, can be lost. So think of it this way. It's like a side door movement can change and restrict the front door movement if we're shifted or if we're rotated. So falls from above tend to restrict the hip and the pelvis. The huge thing down below is an ankle sprain. Rolling the foot and the ankle can then restrict the movement of the shin bone, primarily the tibia bone, but also the fibula bone on the ankle below. And so what's supposed to happen below is you've got a foot here. This ankle is supposed to bend over that, particularly the talus bone. But if you have an ankle sprain and you've lost range of motion down here, you can get caught up here. So when you try to bend in this direction, rather than having a clean bend, guess what? You get a rotation. And so you can see in this system, it's like, watch these tissues. Here's your kneecap, patellar tendon, quad represented by this tissue here. You have your lateral ligaments, but you could also consider this to be IT band, hamstring tendons, And so what happens if we add a shear to that, or a shear this direction? Or the biggest thing, especially for patellofemoral pain, is adding a rotation. And especially when you have a rotation going one way, which tends to be an external rotation excess at the shin, and a rotation the other way, an internal rotation, that is a significant torsion, and a torsion is a twisting. And so you can see that's going to be painful if you add a torsional movement to the normal physiological flexion and extension of the knee. That is the number one source of systems-based knee pain. And so if you think about that, if we have a problem of shears and torsions, if all I do is come in here or just come back here and try to just stretch this or straighten it, that is a front door strategy to a side door problem. Where again, if that joint is a little bit twisted or sheared, it's not going to want to do those normal motions, and you're going to run into a lot of problems. And so the strategy then, the thesis of this approach is we have to take a systems-based approach to treating the knee. We have to treat above at the hip and the pelvis. We have to treat below at the ankle first, because we have to free that system so those bones can align in a neutral way. Once we do that, then anything that we want to do to the knee itself to stretch it, to mobilize it, is going to be much more effective. And so the strategies that I like to employ, generally speaking, are mobility strategies. Again, it tends to be for runners: stiffness at the ankle, stiffness at the hip. And the other interesting thing is even stiffness up in the belly. And so the three things that we can do, the three things that I like to employ, is to use a lacrosse ball to free up the lateral hip. And there are resources in the article from a previous article that I wrote on side door strategies for the hip. Down below at the ankle, to use a strap on the ankle to really apply a strong force to get this tibia bone moving. That's really important, or really useful when you have a stiff old ankle sprain, to apply a belt stretch. Lastly, to use a ball to actually stretch or mobilize the gut. And that is to let a ball, this is a specially designed visceral or gut ball, it's pretty soft, and that is rolling on the ground and stretching and making sure that that large intestine and small intestine can move free of the pelvis, so the pelvis can be properly aligned, so that the femur can be properly aligned. So the take-home message here is this is a complex system, but really the knee is half of the hip and pelvis, half of the ankle and foot, and that contributions or dysfunctions from below and above can really get this joint caught in the middle, cause pain, cause range of motion loss, and even cause instability at times, and otherwise just make it miserable in this joint. So the strategy then, treat below, treat above before going into the middle. Good luck.